The following portion of Daytime is sponsored by Moffitt Cancer Center.
The experts at Moffitt Cancer Center specialize in a range of cancers, such as lung and bronchial. Here to tell us more about the specialty treatment options available for patients is Dr. Sam Freyaldenhoven, a surgeon in the Department of Thoracic Oncology. Thank you so much for taking the time to be with us
Thanks
today.
for having me.
Tell us a little bit more about why someone should consider going to a specialty cancer center such as Moffitt.
It can be overwhelming when a patient has a new diagnosis of a cancer, but one of the key reasons to come to Moffitt for your care is our specialized treatment. So within the Thoracic Oncology program, we're a multidisciplinary team composed of surgeons like myself, medical oncologists, radiation oncologists, pathologists, who are exclusively focused on thoracic cancer. So that's ensuring patients get a specialized and personalized approach to their care. So we regularly meet and determine an effective plan, which may include surgery, chemotherapy, or radiation that's going to be most effective for that patient. As a National Cancer Institute designated comprehensive cancer center, we have access to advanced therapies and clinical trials that may not be available at other centers. And patients that are treated at these designated comprehensive centers can see up to a 25% increase in their overall survival.
Interesting. And you mentioned surgery. So how does surgery play an important role in the treatment of things such as lung cancer? And what is Moffitt's unique approach to that?
So surgery is crucial in lung cancer, especially early stage disease. So when the cancer is localized to the lung tissue itself, surgery, which involves removal of the tumor and the surrounding tissues, can offer the best chance for a long-term outcome. And so at Moffitt, we're at the leading forefront of surgery, including robotic-assisted surgery. So as compared to open or traditional surgery, which involves larger incisions and a longer recovery, robotic surgery is small incisions and precise instruments that are controlled by the surgeon. And so we're able to do complex surgery, even in advanced cases, and have excellent outcomes with it. We're one of the busiest robotic thoracic programs in the Southeast and the nation. And really what that translates into patients is a quicker recovery, less pain, and preservation of their overall lung tissue, and ultimately gets the patients back to their lives quicker.
Wow, that's what people want to hear for sure. For those at home wondering, do you need a referral to go to Moffitt?
You don't necessarily need a referral, but we commonly collaborate with other healthcare providers to coordinate care for patients. If a patient has a new diagnosis of a lung cancer or a pulmonary nodule, they can call our appointment center to establish an appointment, or through the Moffitt website. As part of the Moffitt team, we have patient navigators who assist with arranging that initial appointment, scheduling future appointments, and obtaining all their outside medical records. If a patient is already established with another outside provider, I recommend that they reach out to us and we can expedite that referral.
All right, and we've talked a lot now about treatment options, but what about when it comes to screenings? Is there a guideline that needs to be followed for the screening?
So there are lung cancer screening guidelines, particularly for high-risk individuals. And so since there are no signs when lung cancer, when it's in its early stages, screening gives us the best opportunity to detect it when it's localized and we have the most treatment options. And so Moffitt's committed to the screening process as part of its comprehensive approach to care. We offer screening through our lung nodule clinic, our early detection program, and even our mobile CT screening units. So patients who particularly have a high risk, which include patients 50 to 80 with a significant smoking risk, reach out to their primary provider or one of our specialists to discuss screening.
A lot of options available out there. Doctor, thank you so much for being with us today. And you can find out more information online. Just visit moffitt.org/lung surgery. Daytime will be right back.
The preceding portion of Daytime was sponsored by Moffitt Cancer Center.